Hi, so this is David Raven, A&E consultant at the Heart of England NHS Foundation Trust and the lead clinician for HECTOR, which is Heartland's elderly care, trauma and ongoing recovery programme. And what we're going to try and do with this video is describe why we need to change the way we practice trauma care for elderly patients using eggs. Okay, so what I'm going to do is take a normal egg against a hard-boiled egg. Now, what I'd like to do is get you thinking about both of these and how they're different. Okay, so what I'd like to do is think of the normal egg, which hasn't been boiled, has been cooked as a patient who's over the age of 65, and a hard-boiled egg as a younger patient. Okay, now what we're going to do is start looking at this younger patient. So imagine they've had hard outer shell. Okay, we've removed the shell. Well, my 6-year-old lad has removed the shell before making this video. And what I'd like you to notice is that it's nice and firm. So the egg we can squeeze, it's nice and soft. And actually, if you put a shell around the edge of it, it's relatively well cushioned by the firmness and by the fact that the yolk in the middle is nice and firm. And what I'd like you to do is consider the yolk almost as a solid organ. So like the lungs or like the spleen. It's relatively firm, it's well cushioned, it's pressing against the edges of the shell, which is the bony skeleton. So if you kind of just went ahead and dropped it, it's still relatively well cushioned and you won't expect that yolk to break or have an injury. Whereas if we look at a normal egg that hasn't been cooked, hasn't been boiled, we know inside this there's a nice runny yolk that if we start shaking it around, that yolk is going to get slightly disrupted. The other thing as well is that I'd like you to consider this as an elderly patient really. So the shell is a little bit fragile. If we were to drop it now, it would probably quite easily break. And what we can do is apply a little bit of trauma to this. And we can see it's nice and runny in the middle and we've got this yolk here that's come out. So if we now go and look at this yolk, it's obviously not surrounded by comfortable firm tissue, it's nice and runny. So if you were to just pick it up and just do a little bit of squeezing on it, it's going to all come apart. So I'd like you to imagine this egg as an older individual. Obviously not all older people are like this, but the organs, they atrophy, they shrink, they pull on the mesentery which they're attached to, so that just general little traumas can just cause it to damage itself, can cause it to rupture. And that's how I'd like us to think of this, is that the young patient, nice and firm, the organs are nice and soft, we can apply a bit of trauma but the organ's relatively not damaged, whereas the older patient, a little bit of trauma and that yolk or that organ gets quite easily disrupted. So on the basis of that, we need to start thinking, how do we need to change our approach to stuff? So what I'd like to do for the next video is introduce probably a dangerous combination to the mix, which are infants. So we're going to use infants and we're going to use eggs to try and demonstrate these concepts.